Good morning. Today we'll be studying the chapter of vascular pathology. Now I'll be referring to the book Pathoma because it is the standard book which is used in the USMLE examinations. So if we talk about what is vasculitis, vasculitis is the inflammation of the blood vessels, and it can be further subdivided into three main categories: vasculitis or inflammation of the larger blood vessels, vascular inflammation of the medium-sized blood vessels, and inflammation of the small-sized blood vessels. So now what are the clinical manifestations of vasculitis? They can be divided into two types. For A, the non-specific symptoms, which are just systemic, meaning fever, fatigue, and weight loss, which can't be differentiated from any other disease. For example, fever is the body's natural immune response to an invading organism. And now, as I told you, that we have divided into three categories. The first one is large vessel vasculitis. The first example is giant cell arteritis. Giant cell arteritis is predominantly in people who are above 50 years of age, and the most frequent complication is blindness. Why? Because giant cell arteritis is, as you can see, it is also called temporal arteritis. It's called so because it targets the temporal artery and causes blindness in people. The other frequent complaints in people are headache and visual disturbances. Now, in order to confirm our diagnosis, whenever we take a biopsy, we need to take the biopsy of the complete segment, because any particular segment may not contain the sample. Now, the second one is Takayasu arthritis, and the only main difference between the two is that the Takayasu arthritis is more common in people who are less than 50 years of age, and the main clinical clue by which you can easily guess it's Takayasu arthritis is that the people will have neurologic symptoms, and they will have pulselessness or a weak pulse in their upper extremity. Like giant cell arthritis, they both have granulomatous pattern. Why do they have granulomatous pattern? As you can see that when the body, in response to inflammation, it tries to contain the inflammatory response. Thus, a granuloma is formed. Now we come to medium vessel vasculitis. The first one is polyarthritis nodosa. The main thing you have to remember is that polyarthritis nodosa targets all the main body organs, especially the GIT, which leads to bloody diarrhea. However, the only organ which is spared are the lungs. Now, clinical manifestations, if we talk about it, as I told you, that the person will have bloody diarrhea as well as abdominal distension and extreme pain. Now, it is also associated with positive hepatitis B surface antigen, meaning that the person will also suffer from hepatitis B. And on its microscopic appearance will have a fibrinoid necrosis. This is a pattern of necrosis which we studied in the previous chapters, and it on microscope it will have a string of pearls appearance. Now the disease. Kawasaki disease is predominantly in children under 4 years of age, and it affects the palms. It causes erythema in them as well as the other symptoms such as a strawberry tongue. Now what it does is that it damages the hearts of children, and this is called Kawasaki disease. What are its complications? It may lead to aneurysm, which means a rupture of the blood vessels, as well as myocardial infarction in children. Now, the last one is Burgert disease. Burgert disease primarily affects the distal digits and leads to gangrene formation in people. Why? Because it is a necrotizing vasculitis, and its clinical manifestation is similar to that of people who have encountered frostbite. Now, lastly, the small cell vasculitis is of vessels such as blood capillaries and venules. And the three types are granulomatosis. Vaginal granulomatosis affects the nasopharynx and lungs, and people who suffer from it have frequent complications of sinusitis, as well as blood coming from the nose, which is and of blood and vomit, which is known as hemoptysis. Now, this diagnostic marker is serum, that the serum C ANCA levels will be always positive in this. Now, in the other two cases, microscopic polyangiitis is a similar clinical manifestation. However, the only difference is that unlike serum C ANCA, serum P ANCA will be positive in microscopic polyangiitis. You can see that it resembles the name polyangiitis, and the serum marker correlates with it. Now, the unlike Wagner granulomatosis, granulomas will be absent in it, and Church-Strauss syndrome, which is the final one we'll be discussing in this category, it is characterized by increased amount of eosinophils, and you know that eosinophils there are more amount in people who have an allergic response or who have hypersensitivity reaction. So they will be greatly increased in number in people who are suffering from type 1 hypersensitivity diseases such as asthma. Now, coming to hypertension. Hypertension is a frequent problem and it is also known as a silent killer. Hypertension leads to many other problems and it can be further subdivided into two categories: benign hypertension and malignant hypertension. Malignant hypertension is an emergency case and it has to be treated immediately because it can lead to several complications such as retinal hemorrhages, renal failure, and even stroke. Malignant hypertension is that hypertension which is above 200 millimeter mercury, that's systolic pressure, and the normal systolic diastolic pressure is 120 by 80. However, as we get older, above 40, the normal systolic pressure gets elevated naturally to about 130. So that therefore the definitions get revised. However, the most acceptable definition is that systemic hypertension is when the blood pressure gets elevated above 140 by 90. Now, there are two causes of hypertension. The first one is primary, which means that the cause is idiopathic. Idiopathic means that the cause is unknown. And secondary hypertension, which means that the cause is known. It can be due to a variety of reasons. For example, the renal artery stenosis. Obviously, when there will be stenosis, there will be decrease in blood flow. And in response to a decrease in blood flow, there will be increased amount of angiotensin released by the kidneys. Angiotensin will further cause vasoconstriction of the blood vessels and increase the blood pressure. Now, apart from these causes, the other causes include fibromuscular dysplasia in humans, in females, which means dysplasia is the disarrangement of the normal epithelium, and atherosclerosis, in which there is a plaque formation. Now we'll be talking about arteriosclerosis. Arteriosclerosis, although it resembles atherosclerosis, it means hardening of the arteries, and the two terms are almost similar to each other. So the important thing which you need to know is that atherosclerosis is more predominant in males. Why is it? Why is it? Because males do not have estrogen, greater amount of estrogen in them, because the estrogen in males is converted into testosterone, and thus females, even postmenopausal females, have get lesser chance of developing MI because of the greater estrogen in them, which acts as a protective layer against MI. Now, what happens in atherosclerosis, the pathogenesis is that the endothelium acts as a protective barrier against all injurious stimuli. However, when there is a damage to the endothelium by toxins such as alcohol or smoking, the endothelium gets damaged and its barrier gets disrupted. Now the lipids leak into the intimal layer. There are three layers: intima, media, and externa. Once the lipids leak through the intima, they are oxidized and converted into foam cells by macrophages. Macrophages, as we all know, like consume the harmful debris up, and once they're converted into foam cells, the foam cells also contain large amounts of cholesterol. There is deposition of extracellular matrix and smooth muscles, which lead to extra connective tissue deposition. And once the smooth muscle connective tissue is deposited again and again, this leads to the formation and tone of an internal plaque. Now, there are other microscopic things as well, such as fatty streaks. Now, fatty streaks are physiological and they begin to develop normally in your child at about 10 years of age. However, the important thing you need to know is that whenever atherosclerosis happens up after 50 years of age, what happens is that the fatty streaks accumulate too much and the plaque forms at the same site at which the fatty streaks used to form. Now, the complications of atherosclerosis are angina. Angina, what is angina? Angina is reversible chest pain, which is due to the narrowing of arteries. We will be studying the further in the next chapter about the types of angina, the stable, unstable, and Prince metal angina. The difference between angina and MI is that one angina only lasts temporarily, however, myocardial infarction is irreversible. Now I'm just covering the most important topics. So now an arteriosclerosis, as we talked previously as well, that arteriosclerosis mean the narrowing of arteries. It is further divided into two categories, hyaline and hyperplastic. Hyperplastic arteriosclerosis gives an onion ring skin appearance, and it is the consequence of malignant hypertension. Here are a few of the pictures. As you can see that this is more resembles like an onion ring, whereas the other one, hyaline arteriosclerosis, is a consequence of benign hypertension, and it is a more of a chronic hypertension which develops over the passage of many years. And even long-standing hypertension can lead to end organ damage, and the most frequently damaged organ are the kidneys. Now, in Monckeberg medial calcific, as the name suggests, that there is calcification and deposition of calcium in the arteries, thus they are obstructed. Now we come into aortic dissection. What is aortic dissection? Aortic dissection is a tear in the intima through which the blood passes into the media of the aortic wall, in which it is not supposed to be there in the first place. So now the main cause of aortic dissection is hypertension. This is the number one cause, and the other cause of aortic dissection is that there is an inherent weakness in the media because of either there is less amount of deposition of smooth muscles, or the person is suffering from a inherited connective tissue disorders such as Marfan syndrome or Ehlers-Danlos syndrome, which are autosomal dominant disorders. What happens in aortic dissection is that the person has a extremely sharp tearing chest pain, and it radiates to the back. The frequent complications of aortic dissection are cardiac tamponade and hemorrhage. Now we'll be talking about the two types of aneurysm, thoracic and aortic aneurysm, abdominal aortic. The most frequently tested aneurysm is the abdominal aortic aneurysm, and we need to know its presenting symptoms are hypotension. It appears as a pulsatile mass, and the person also has extreme flank pain. Now, what it does is that the all types of aneurysm compress the nearby structures, and in this case, it's the ureter which is being compressed. In the case of an abdominal aortic aneurysm, we also need to know the location of the aneurysm. This type of aneurysm is always lies below the renal arteries, but above the aortic bifurcation. And in the case of thoracic aneurysm, you just have to remember that the properties are similar as the name suggests. The thoracic aneurysm is a tree bark aneurysm. Its basically shape resembles it like a tree bark, and the disease which is characterized by it is syphilis. It is predominantly seen in tertiary syphilis. So, like I told you that all aneurysm can compress the structures nearby it, since the abdominal aortic aneurysm had a ureter close to it, so it basically compressed the ureter. However, in the case of thoracic aneurysm, the structures close to it are the mediastinal structures, thus it will compress the air one or of esophagus and would lead to respiratory difficulties or even embolus. Now, these are the classical pictures of an aortic dissection. You can see the tear in the intima. This is the tree bark appearance of a thoracic aneurysm. And this is the abdominal aortic aneurysm, which, as you can see, is much dilated and pulsatile. Now, these are the three types of vascular tumors. Hemangioma is the main tumor present in children, and it is benign. What benign means that it is formed in mainly in children at about 2 to 3 years of age, and it automatically regresses in most children by about 7 to 10 years of age, and hemangioma is the most common benign tumor. Now, angiosarcoma is a malignant tumor. This means that it will metastasize to other organs, and whenever you hear the term angio, the one thing you should always remember is the liver. So the angiosarcoma is the most common type of liver cancer, and the number one, although three substances have been written, however, the number one substance is PVC polyvinyl chloride exposure. Now, finally, Kaposi sarcoma. Kaposi sarcoma is also malignant proliferation, and the virus which causes it is herpes virus 8. Now, show you the pictures here. Here is the classical hemangioma, and this is the Kaposi sarcoma. You can see that its basically presentation resembles that of HIV patients. So now, what happens in Kaposi sarcoma is that there is an appearance of collective nodules and purple patches. Initially, the patches are in the form of blisters. However, after time passes, they become like nodules and rough on the surface. Now, they are classically seen in patients of AIDS and in homosexual patients, as well as in transplant patients, because we all know that HIV has two modes of transfer: sexually, and secondly by contaminated needles or blood products. So now this wraps up our chapter on vascular pathology. We'll be covering cardiac pathology in the next lecture. Thank you for listening attentively.